Hi students, welcome to Learning Unit in week number 3. Interoperability and legislation in transforming healthcare will be our topic, and we'll be focusing on chapter 11 this week. Our student learning outcomes are that you will compose an originally written summary of the 3 meaningful use components, including background information, current examples, and the current state of the policy priority, which we will discuss a little further. And then you'll also discuss a conversation that you've had with a network contact as a nurse leader. So we'll be talking a little bit about meaningful use, which is really important and is something that you may have seen. In fact, for example, maybe in documentation, someone has said you must click this exact spot to document smoking, or something like that. It's included in how we use our electronic health records properly. Another part that came out of meaningful use is making sure that patients are getting letters about their testing, for labs or for radiology or things like that. So all of that has started from this high-tech act. So the meaningful use presentation, your assignment, its purpose is the American Reinvestment and Recovery Act of 2009 included this revolutionary health information technology for economic and clinical health, or what we call the High-Tech Act. The High-Tech Act proposed this critical national goal for the meaningful use of interoperable electronic health records throughout the U.S. healthcare delivery system. So they wanted us to use our health records that we have in a meaningful way. And this concept This concept of meaningful use was based upon 5 pillars of health outcomes policy priorities: improving quality, safety, efficiency, and reducing health disparities, engaging patients and families in their own health, improving care coordination, improving population and public health, and ensuring adequate privacy and security protection for personal health information. So all of these pillars together, these 5 pillars, seek to establish a healthcare system that is safe, engaging, and interconnected for all U.S. healthcare consumers, which we know is not perfect, but at least it starts to force us to use our electronic health records in a way that is really actually going to be efficient and lead to good health outcomes. Otherwise, why are we using these electronic health records other than to just store information? So what you'll do is create an originally written paper or summary of the 3 meaningful use components, so background information, current examples, and current state of the policy priority. An example of background information would be the High-Tech Act or meaningful use. If you go to national centers or initiatives where you should be getting your sources from, such as cms.gov or ahrq.gov, you can find information on the High-Tech Act or what meaningful use is and what we're doing for this. So the background information on how this came to be or what's happening. The current examples is what has been done to improve those 5 pillars. What has been done to improve care coordination? What can you find that addresses the 5 pillars outcomes? You can choose to talk about each pillar separately, just briefly. You can choose one pillar and go in depth. You can give a global, again, using all 5 pillars. How are we doing in our policy priority at the state, local, or national level? So you can choose one pillar and talk about state, local, or national, or even what's being done in your particular hospital, adding that to that. So what's out there as far as the policies are concerned that is helping to address these 5 pillars. And again, you can do a global and just choose to write about each one separately, or you can choose one pillar and go very in-depth. It's your choice. Your information should be sourced from national centers or initiatives where mostly possible from cms.gov or ahrq.gov or other credible sites, or using peer-reviewed journal articles, and how long. A lot of times there's not really a page requirement. You're in a master's course and you want to be able to determine the length you need to get your summary completed, an estimated 4 to 6 pages or 5 to 7, but there's really no true requirement, and no points will be deducted for going over a certain page amount or not having enough, as long as you're getting your points across and, explaining those three components. And I would also note that Chapter 11 will give you some health background. So if you have any questions, reach out. I'd be happy to help answer any of these questions about the assignment. So speaking of Chapter 11, health information technology and connecting, there's three major concepts that we're kind of going to learn about in this chapter: the United States healthcare versus other countries' healthcare, healthcare as a business versus healthcare as a right, and health disparities versus care for all. So you'll see that, there are other countries that do things a lot differently than the US. And then healthcare is considered a right there. In the US, healthcare is not considered a given right. And not all people have the same healthcare available. There is some benefit to having this healthcare system or model that we have, which gives us more choice, more opportunity. There is also a disadvantage that at these other countries where it's considered a right or it's global, that they have to stand in line to wait unless they're very sick. Maybe in Canada, you might wait a year for surgery or something like that. So there is some disparity between both sides of the story. And then in the US, healthcare tends to be seen as a business. So just all of those are just things to think about as we go through this week. And health disparities versus care for all, in the US, we spend the most money per person in the world on healthcare. Yet we still have these healthcare disparities between the poor, immigrants, people of color. And why is that? So in rural versus urban states, just some things again to think about as you read through these chapters. And as we start to think more of a global systems perspective, even our own Centers for Disease Control and Prevention has international health regulations. The link is pasted here, and this is just a small infographic which shows you that, it starts with detection, making sure surveillance systems and laboratories can detect potential threats. And this may be different for the US versus other countries. In the US, it may be HIV, STDs, tick-borne diseases in certain parts of the country, like our local sites in Erie or in Pennsylvania. In other countries, it might be malaria. So detection, and the next step would be assessment, working with other countries. Of course, an example of this is the COVID pandemic. Countries were working together. We were publishing information at a rapid pace, sharing information across the board for these public health emergencies. And then reporting specific diseases plus any potential international public health emergencies. So again, making us think of the COVID pandemic. And finally, responding to these public health events. So maintaining global health security means that we must respond efficiently and sufficiently to make sure that these public health events and emergencies are handled as timely as possible. And you can see this infographic here kind of explains what the IHR are, and then I'll make sure that this is posted in the link so that you can click on this if you want to see this infographic larger. I just thought it was a nice way to kind of share what these international health regulations are and the thought behind how we make public health important. So now for the networking or connect component of Chapter 11, networking as a nurse leader. In week 1, we talked about building a culture of trust. Last week, we talked about frequent communication, and that's why we had that ongoing communication in our discussion board. And then this week is connecting with intent. When you meet someone, you give that first impression when you're building that culture of trust, building that network and people you can rely on. So in thinking of an example of this, as part of my stroke team where I worked at Allegheny Health Network, we were a team of 7 to 9 stroke coordinators who were just meeting for the first time. We had to build that culture of trust by working well with one another. We met twice a week with frequent communication, sharing best practices, sharing, how we at each hospital care for stroke patients at different levels of care, different levels of nursing staff, different levels of equipment and laboratory testing and services that we offer. And then connecting with intent as we shared, supplies and educational modules and even job candidates, like, oh, someone is moving to Erie, maybe this is someone you would really want on your team. So it's really important networking as a nurse leader that we start to build those connections within so that we can accomplish care across the spectrum. And so for our discussion board for week 3, you will find that having a healthy network of people, just like I explained in that example about my stroke collaborative is what we called it. It makes your professional life easier, more enjoyable, and it really allows you to kind of share ideas and best practices. And of course, there are many ways that you can maintain and build this good network, which also allows you to kind of stand out in the crowd. For example, have you gone out of your way to help when a colleague is struggling? Have you sent an email of support or stopped a colleague you saw when you knew that he or she could use that support from you because of something that happened? This is what makes you memorable to other people. And it's important for you to stand out in a good way as a leader as well, because, you build those connections with other people, and then it helps you get things accomplished, and you're able to continue to build those connections between departments that are really interrelated within the hospital. So benefits of a healthy network also include new trends, recommendation, new job candidates, referrals, fast answers to questions. If you've built that rapport with the radiology director and you have a quick question that you send out to them, they are more than likely willing to get you a quick answer to a question that you have. So networking is applicable to informatics, nursing, leadership, systems thinking across the board, right? It's not just within your department, it's across hospitals, networks, and even sometimes across different, hospital or organizations. For example, we have the International Stroke Conference every year that we do, and that allows people to get together and share all of their ideas and things that we're doing in healthcare to build better care for our patients, stroke patients across the globe. And it's because we're networking and we're using all of these ways to do that. So for your discussion this week, you will have 2 tasks. Post about methods you can use to keep your professional network active, and what does the literature or current research offer as ways to do this. I know a lot of people are probably thinking immediately about Indeed or LinkedIn, so that's one thing. And then the second task will be having a meaningful conversation with someone in your network. Now, this is not something that you have to post in your discussion, but if you want to, you could share it totally. And remember that everything we discuss in the discussion boards should be held confidential and not discussed outside of the course. So if someone posts something about a meaningful conversation, then we should not be discussing that outside of our discussion board. And then, of course, replying thoughtfully to our other posts from the week according to the discussion board rubric. And so week 3 tasks by 11:59 on Sunday, you'll want to make sure that you reviewed and completed the activities in Blackboard, watching this video, reading chapter 11, participating in the discussion, and completing that meaningful use presentation assignment and uploading that Word document to the course link. Again, if you have any questions about anything, then please reach out. I hope you have a good week 3, and I look forward to seeing your work.